Dear guys, this is open-angle glaucoma patient that I done cataract surgery, and at the end of the procedure I do some openings into the trabecular meshwork using the 25 gauge Vitreous cutter. So having a round capsular axis, using the grease-hour forceps, doing the hydrodissection, rotating the nucleus a little bit inside the bag, opening up a little bit more one of the paracenteses to use it as a main incision, and then using the chopper I do the horizontal chop, engaging the nucleus with the phaco needle deep inside the middle of the nucleus, and having two heminucleuses separated all the way through. It's an easy job. Again, another horizontal chop, and I have one small fragment to take out and emulsify. The patient is dancing with the head a little bit and moving it around, but is making the surgery more interesting. It's no big deal. We can manage this type of patients just like a regular patient. You have to just use both feet in the same time. One to do phacoemulsification, pressing down the phaco pedal, and then the other one to just move the microscope around to follow the patient's head, and keeping the eye inside the viewing parameters. Getting the last part of the nucleus out, and emulsify it inside the bag into the safe zone. The patient is really starting to dance, but we can finish the phacoemulsification in a safe way. Taking out the epinucleus also, and then trying to emulsify, try to aspirate as much as possible the cortex, also using the phaco probe. It's a pretty clean bag, couple of fibers of couple of strands of cortex, and with the phaco machine into the irrigation aspiration mode. It's an easy way to do, pointing the bevel towards the cortical area where you need to do the aspiration, and pushing the patient head in the same time to not be taking out of the field of viewing, and pretty much the cortex can be aspirated just using the phaco probe. It's a meticulous part of the surgery, but with persistence we can do it. And then injecting the IOL inside the bag, and taking the last cortical remnants using the aspiration needle, and then placing the hydrophilic IOL into the bag, using the tip of the injector and pushing it down, and then washing out the viscoelastic from the anterior chamber. And in these glaucoma patients, I believe it's important to wash it underneath the IOL also. I'm pushing it down the iris, not to release the synechia because this is an open angle glaucoma, but to further bring down the pupil. We know that touching the iris will loosen up the dilatation. So, and now using the 25 gauge vitro cutter with cutting activated only when we're not seeing the opening anymore, then we know that we are exactly underneath the trabecular meshwork. Thank you for your attention.